Welcome back. This is Good Morning Kenya. I'm Jane Wamboy. If you are just joining us, we are glad you chose to be with us. Now, we want to continue with today's discussion and move on to the next topic of discussion. And this is all about the welfare of our medics who are at the front line in the fight against COVID-19. In the recent week or so, there has been so much that is being said when it comes to how we are protecting our doctors and our nurses as they do all they can to help protect and curb the spread of COVID-19. But from the medics side of things, most of them are saying we are ill-equipped, we are not prepared to fight this disease because we are risking our health because we haven't been given the necessary gear that we need in the fight against COVID-19. So we want to have this discussion, and joining us right now is Yubrin Moraa, who is a physician in the internal med department at Mpisha Hospital. Hi, Yubrin.
Hi, good morning.
Good morning. How are you doing this morning?
I'm fine. How are you doing?
Fine, thank you. Thank you so much for making time to talk to us this morning.
Thank you for having me.
Now, let's just get straight into it. Now, when you look at the provisions that have been stipulated by the World Health Organization, there are protocols when it comes to safety of health workers, both in terms of their protection personally and equipment. Just paint for us a picture of how things are on ground as a medic.
Maybe to just take you back and discuss what the WHO really has recommended as we fight this pandemic.
Absolutely.
Is that workers' welfare and their well-being and their protection is a very paramount pillar on what they have set aside to fight this pandemic. So besides making sure we protect our health workers, the other thing that we're supposed to do is protect the vulnerable, and also to make sure that the developing nations or nations that don't have the capacity are also helped out by the global health body. So having said that, health workers then become a very big population that needs to be protected, not just because they form the army, but because they are supposed to be, they can act as a source of infection to the community, to themselves, to the families. And just remember, what precedes everything else is the right to life, and we have to protect our health workers.
Yes. Now, looking at some of the protocols that World Health Organization has put in place, especially in terms of equipment and gear, what are some of those basic equipment and gears that all medics should be provided with as they fight, as they're at the front line in the fight against COVID-19?
So all medics are supposed to be provided with the protective gear, the PPEs, which is the gown and the goggles that they have to wear, the boots and all that. And most importantly, again, is remember before now they can wear the PPEs, which is the complete outfit when they are facing a patient who's a confirmed case of COVID. They're supposed to have the masks that are supposed to protect them. So the respiratory masks that are supposed to protect them when they're approaching this patient. They should be able to be working in a facility that has running water where they can clean up, just like every Kenyan is. They're supposed to work with an infrastructure that can support them, making sure that they are protected from acquiring this disease. So having said that, then the question begs then is, when these health workers are seeing patients, and remember, there's a famous quote from Italy where they're saying that this virus is walking, it's getting its legs walking around from patients who are asymptomatic. So if we're going to confront patients that we don't know whether they have the disease or not, as we are in this phase in Kenya where we are having a case definition before we can actually decide that we're wearing the protective gear, then we are risking a lot. And as I like saying this analogy of, if you have an army, the army is inadequate and you're risking even losing 2 members of your army, then we will be facing very unprecedented catastrophe where you need an army to fight an enemy and your army is running out because either isolation or any other reason that makes the member of the army not be at work.
Now, over the weekend, there was a medic who actually was suspended as a result of refusing to render services to a patient who was showing signs and symptoms that were pointing to coronavirus. Do you think he was right to do so because he was demanding for a specific kind of mask, the N95, which he was saying was the required one when it comes to filtering airborne diseases? Was he right to do so?
the medical provider was right to do so. But just to correct you that the county government of Kisii corrected that error. Right now, the medical officer is back to work, and the letter was retracted. But it is very important for every health worker to realize that if you're asked to see a patient with potential COVID and you're not provided with the adequate protective gear, then you're actually risking your life, and you're risking the lives of so many other people besides your family. So it does not become a blame game of the doctor or the health worker refused to see the patient. It becomes a blame game of the manager that is supposed to provide those things. It becomes a blame game of the citizenry, the government, the philanthropists who are supposed to help us, because we also have to acknowledge that this protective gears are not necessarily available. Every country in the West is holding on to what they have. So if they're holding on to what, which innovative ways as Kenyans from every sector of life are we doing to make sure that we protect our army? And this calls for a lot of patriotism from our end, where we can actually say, like, this is the problem, and because we are already in this, what are the solutions?
Now, when it comes to issues to do with exposure, of course, when you are exposed to this virus, when you are within the confines of a hospital, there is some sense of insurance that comes along. But in a case where, you know, there was a story that was actually written in the past week that there were some medics who had to go into quarantine because the patient they were attending to, who was showing signs and symptoms of COVID-19, failed to disclose their travel history. And the hospital categorized this as, you know, low-risk exposure. How then can the medics be protected in such cases where the patient, due to cases of non-disclosure, they are exposed? How can they be protected from such cases?
I think my thoughts on this is why we are having people not disclosing is arising from social stigma. And maybe I'll pose a question to you. How are we propagating stigma? If we are propagating stigma on the words we use, on how we are labeling the patients who've contracted the virus, are we labeling them as they did something wrong, so that is why they're getting this, or those are the people with the COVID, you even label the patient the COVID patient. So stigma is something that as a government, our government needs to look into it and make sure that we destigmatize it, so that people understand that this virus does not discriminate. It can be contracted by any Kenyan from any point of this country. And why we actually just talk about vulnerable populations is we are trying to highlight the people who, when they contract the virus, the likelihood of adverse effects from it or adverse eventualities are more likely. And those are the patients we talk about, the diabetics, the patients who have any form of immunosuppression, meaning their immunity is suppressed for any reason. Those are the ones at risk of adverse eventuality, not because that this virus is only catching some people. I had some people in the village saying that it's catching some people, it's for the rich people, so these rich people should not tell us about it. So I think my favorite quote as I say this is that we look at a construction worker, and we should look at a construction worker in a construction site. They wouldn't be allowed to go and work without a hat that is protecting them and protecting goods. So even as these patients are stigmatized and they're not disclosing, and that's a very real scenario for us as health workers, then the question is, does the health worker then approach patients at this era of the COVID pandemic?
Now, also still looking at the welfare of medics, you know, there's some research that is showing that medics who are attending to all these patients are actually reporting high rates of depression, anxiety, insomnia, and even psychosocial depression, and especially women. Why do you think this is so?
You know, one of my very good friends, who's a doctor, who's really in the front line and is very passionate about the welfare of health workers, was telling me yesterday that she couldn't sleep. You know, she gets into bed and she just thinks about this. One, let's consider that this virus is not very well known. The transmission, we actually we are postulating how it is transmitted. We are not very sure about how does it develop and what are the ways and the ways that it can affect someone. And remember, here is an army attacking or trying to fight an enemy that is barely known. It's a new enemy, okay? As we said, it's a novel virus that has come to the human race. So health workers are actually very stressed. And these are the times, besides just them not being unsure about and being worried about their families. They're also going through burnout, which is because of long working hours, frustrating working environment because of one reason or the other, because the numbers are small. And maybe this is the time that we should look at what are the contributors of these health workers lacking morale, and some of them tipping into depression and other psychiatric complications. So we should look at the work environment, the working hours, and the human personnel. And are they adequate enough for the resources that we have? Are they adequate for our setup? Are they adequate for the hospitals we have? So that the government said they're hiring health workers, but this is the time, if you ask me, they should absorb every health worker.
As opposed to bringing fresh blood.
Yes, absorb every health worker, because I know from statistics from the doctors union, there's so many young medical officers, totaling to about 2,000 who don't have jobs. Why should they be seated out there when we need every hand? Even what we have in the country is not enough. So everyone should be hired. Everyone should get into that system to try and fight this. So I think if we don't address those things early and we wait to respond when the numbers are so big or our hospitals are overwhelmed, then we will be reading from a script, because we will be reactionary and not proactive.
Now, we're also hearing conversations about a looming strike, and this is most especially in Meru County, where doctors are saying they're going to down their tools by the 3rd of April if their salaries from February will not have been dispensed. Do you think this is right to do so, especially during this space and time we are in the fight against the coronavirus?
With all my love for this country and all that I care about and my patriotism, and that's the fact that even with our own problems, I am very proud to be Kenyan. I think this is the wrong time. But what I would also say is that we should not ignore the cries from those health workers. And those are the things that we need to make sure we seal all those loopholes as government, as citizens, as corporate institutions, as every Kenyan, because this fight is not for one individual. It's not for government. It's not for Dr. Moraa because she works in a hospital. It's for every Kenyan. So this is the time all those loopholes need to be sealed. The governors in those affected counties and the county health executive members should sit down and agree with these health workers on the way forward. Forge a way forward that does not involve confrontation, because we can't afford it at this time.
We can't afford a strike at this time. Now, as we bring this conversation to a close, in terms of motivation, psychosocial support, efficiency to help our doctors, just avoid burnout and just to keep them motivated, and especially when it comes to accommodation, because you find that some of them have had to create makeshift places to just spend the night. How can this be better improved to help our medics as they continue to be at the forefront in the fight against COVID-19?
I think I'll put it in a very easy pointer. One, we should ensure that as a nation, and that I think with my words, I'm choosing them very carefully because I want us to look at this from a very patriotic angle. As a nation and not as government. As a nation, we should ensure that our health workers are provided with the required necessary protective gear to face patients and face this pandemic. Number two, health workers, we should ensure that we have a support system, psychological support. We've done a call for action for health workers who are volunteering and agreeing to volunteer to assist, but we should make sure that we have a support system for them and their families. We should make sure that these health workers can be guaranteed of medical care by ensuring they have medical insurance and measures put in place for their compensation in case of any eventuality, so that they are well motivated and they feel this is my war, but I can be guaranteed that my family and myself are protected. And the other thing is to just give them motivation for whatever way, just motivate our health workers so that they actually go to war motivated. And this is a war for Kenya, and most importantly, it's a war for healthcare workers.
All right. Thank you so much, Yubrin Moraa. That is Dr. Yubrin Moraa that we have been speaking with. She is a physician in internal med working with NP Hospital. Now, that is all about the welfare of our doctors who are at the forefront in the fight against COVID-19 in Kenya and the world over. So many of them are not well protected and equipped in this fight. And of course, as she has said, we are fighting an invisible giant. We are yet to know what we are dealing with. So why don't we do the best we can as a race to help protect these people who have have taken an oath to protect lives. All right, that is that for that. So keep talking to us. Remember, the hashtag is still Good Morning Kenya at KBC Channel 1 is our official station handle. My handle is Jane Wambui, and my colleagues at Ramaguko and at Dorina Range is how you can find them individually across all social media platforms. And our SMS number is 20154.